My name is Deirdre Siddaway, Respiratory Nurse Specialist in Primary Care, working in Ipswich, Suffolk, and also with the committee of the Association of Respiratory Nurse Specialists. This is part 5 of a 6-part series when we're looking at the things we must remember in order to provide a quality, structured asthma review. And this time we're going to look at stepping down treatment. So, it's in the BTS sign guideline, but do you always consider doing it? We know that high doses of inhaled steroids can increase the risk of diabetes, cataracts, adrenal suppression and osteoporosis, and there is emerging evidence of an increase in respiratory infections. Once you know that the asthma is controlled, and we looked at that in part 2, the BTS sign guideline recommend reducing the inhaled steroid dose by 25 to 50% each time every 2 to 3 months. And this is because people with asthma may have deterioration of their asthma at different rates. Think about triggers which affect patients' asthma. For example, if they have seasonal allergic rhinitis, don't step their treatment down in the summer. Explain why and how to reduce the dose, and what to do if they experience symptoms, and give written information. Useful documents include the PCRS UK reviewing asthma patients on high-dose inhaled steroids, and there are others which are referenced at the end. At step 3, consider prescribing a lower dose of inhaler rather than reducing the number of actuations taken. I tend to step down when there is at least half of the original inhaler left, so the patient has the confidence they can restart that if they experience symptoms. So, if we're stepping down at step 2, maybe using Plenil 2 puffs twice a day, instead of doing 2 puffs and 2 puffs, I suggest to patients to do 2 and 1, so reducing either the morning or the evening dose. 2 or 3 months, still fine, still no salbutamol, still no symptoms, down to 1 and 1, and then if they got down to that stage, I'd suggest they came back to see me. So in summary, make sure you're confident about how to assess the asthma control, which we covered in part 2. Make sure you know how to step down the treatment, that's by 25 to 50% each time every 2 to 3 months. And remember to always consider this if it's appropriate.